My name's Dr. Manrina Rhode and I am the aesthetic dentistry expert for dentistry.co.uk. And today I'm talking to you about gum fillers. Now, this is such a talked about topic, and I feel like it's such a talked about topic because it's a bit of a mystery. There are a handful of dentists offering this treatment in the UK. I was the dentist to bring the treatment to the UK about 8 years ago. I was studying in America and I happened to come across a course there on this interesting topic, gum fillers, and I went and learnt about it and brought the treatment to the UK, and I have done so many cases since coming back here and slowly spreading the word, and I think more and more clinicians are also trying to learn how to do it. I think the big mystery behind it is that there are no courses that people can go on to go and learn about it, and so I get these messages so often saying, you know, when are the courses coming out and how can we learn how to do this? So I have created an online course about it. It will be launching in 2025 and may have already launched by the time this has come out. So if you're interested in that, then obviously find me and I can teach you. But in the meantime, let me tell you a little bit about how the process works. It will only work for black triangles, so in between teeth. It doesn't work for black triangles between implants. It doesn't work for black triangles between a tooth and a bridge. You want to have two teeth where you've got some papilla that you want to make slightly bigger. There's only so much space within that papilla that you can fill. So you fill it with hyaluronic acid filler, the same filler as you would use for lip fillers. And there's only a tiny amount that you can pop in. And what happens is, as you start to pop the filler in, it starts coming out either through the sulcus or through the injection point where the injection's gone in. So it's limited, your results are limited. Now, the good thing about this is that also black triangles are really tiny, right? They're not like usually not a massively visible thing, so you can get quite a lovely result from it, unless they're there perhaps because of bone loss or periodontal disease. Now, if it is due to periodontal disease, then it's really important to get the periodontal disease stabilized before injecting the gums with gum fillers. How long does the treatment last? We tell patients that it will last for 6 months, but to be honest, I've been doing this treatment for about 8 years now, and I've not had anyone come back needing more. Actually, what we're taught is that it will probably stay there forever. The gums are not an area of the mouth or the body that move very much, so there's no reason for that filler to dissipate. But you tell patients 6 months just so you're covering yourself in case it was in that amount of time that they felt like they needed more. You wouldn't want to promise that it would last forever, although I think I probably will start promising longer than 6 months now with 8 years worth of case studies showing that it's lasting really well. Once the hyaluronic acid's placed inside the gum, they get an immediate result, so immediately they can see the gums are better. And then as the hyaluronic acid picks up water, the gums expand a little bit more, and they're allowed to expand a little bit more as the entry point of the needle closes over, so the filler's not just coming straight out again, but it's locked within the gum and then can expand. So typically we get a fabulous result. I'll get a patient back for a review within 2 to 4 weeks from the initial gum filler, and it's rare that at that review we need to pop any more in. Typically they're really happy with the result. If it's a really large black triangle, maybe it's something that you want to combine with interproximal bonding to close up those triangles, or veneers or ortho, however it is that you want to close those triangles. Often it's patients who don't want those treatments because, you know, interproximal bonding has its own limitations. Bonding will stain at the best of time and interproximal areas will stain at the best of time. So combining the two isn't always the best option. So gum filler for a larger black triangle may be a compromise, but it may be enough for the patient just to not feel so self-conscious that there's kind of a black area there where food's getting stuck, or it looks like there's food stuck at other times. So it's just another example of how dentistry or the treatments that we can do in the mouth are evolving and becoming easier options, more straightforward options for our patients to get really fantastic results, less downtime and better long-lasting results.